Tonight, we start with a look at the state of senior care across Minnesota that's only gotten worse since the pandemic, losing as many as 3,000 nursing home beds since then because of financial troubles and short staffing. In fact, the state just found a facility near Rochester in violation for only scheduling one caregiver overnight, when at times it had up to 59 people there.
Now, these problems are complex and the solutions aren't easy either. Jennifer Hoff digging into what has to happen to save the industry. Jennifer.
Chris, lawmakers approved millions of dollars in state funding last year, and there are several new regulatory changes as well, including a workforce standards board to try and help the industry be more stable and inviting in the long run.
In Minnesota, there are some 2,500 long-term care facilities. About half are members of a nonprofit providing education and advocacy led by Toby Pearson.
What is the state right now of nursing homes and assisted living facilities in Minnesota?
From an on-the-ground perspective, our workforce still has not come back.
The persistent staffing shortages led to 8 nursing home closures last year and 15 more in the 3 years before that.
So how long is long enough before we start to see some changes?
Things take time, and the eternal optimist in me says we're going to get there next year.
That's when the legislature might provide another funding boost, like last year when lawmakers approved $173 million in one-time funding that helped pay down debt. Pearson now hopeful for more to boost wages and recruit workers.
There needs to be quality care that's provided, and it's not acceptable to fail in that.
This month, the state found a facility that cares for dementia patients near Rochester in violation for routinely being understaffed and gave Prairie Meadows a week to reach compliance. New federal regulations require certain minimum staffing levels as well as pay requirements, and the state created a standards board that Pearson says, given all these problems, can be hard to meet.
At the same time, we have to try to do better.
Now, Prairie Meadows, the assisted living center in the story, came into compliance, it says, within 1 day of receiving the state's notice, and that, quote, at no time were the health and safety of our residents compromised. As for Pearson, he says his next step is to try to now create an access map that shows exactly where there are gaps in care, which, as we know, is historically happening in greater Minnesota, and just how far people are willing to travel to get that care, Lauren, especially with such fewer facilities now open.
Yeah, still a lot of work. Jennifer, thank you.